For more than 15 years, medically underserved children, adults, and the elderly from all over the St. Louis area have had improved access to primary health care services because of the Institute for Family Medicine. The Institute did it through caring and collaboration.
Well, I can't actually say that what we're doing now is what I envisioned when we formed the organization back in 2000. We formed the organization because the St. Louis County Department of Health asked me to put together a group of docs to provide primary care services in their 3 clinics. And we did that, and then suddenly we had a fairly large organization with a number of healthcare providers, and we looked around the community and said, what else can we do?
To get an answer, Dr. Campbell approached the Jennings School District. He simply asked, "Are you interested about expanding school-based health services within the district?" The answer, yes. Well, that began a partnership that still exists. Once a week, one of the Institute's physicians or nurse practitioners make a weekly visit to the school district to address the current health care needs of the students. As you would expect, it didn't take long for word of this arrangement to spread. Other school districts wanted to join with the Institute for Family Medicine. Dr. Campbell has another great example of how still another district got involved.
One of my patients was on the school board for Hancock Place School District, and when she saw what we were doing at Jennings, she came to me and asked me if I would meet with the superintendent. I remember her words. She said, "We need this at Hancock."
So the Hancock Place School District has had a terrific partnership with the Institute for Family Medicine dating back to 2002. And while I was not superintendent at the time, the Board of Education and then the current superintendent felt that the district needed to provide additional services for our students and the members of our community. In doing that, we researched and found the Institute, and after talking with them for some time, decided that there was a great opportunity for us to form an in-house clinic here in the Hancock Place School District to be able to serve not only students and parents, but also the community at large. Anyone in the 63125 zip code is able to benefit from this joint partnership. We've even had situations where families or students have had more extensive needs, and by seeing the Institute off-site, they've been able to get those taken care of at a very low cost, and again with the confidence of knowing someone who cares about them are taking care of their physical needs. Educationally, that's important to us because we know that students that are healthy and happy and safe are going to be ready to learn every single day. So this support and this joint benefit and venture that we've engaged in has been positive all the way around.
You know what happened next. And now even more school districts wanted to join with the Institute for Family Medicine. Some issues were common to all districts, but some were unique. The Institute would evaluate the needs and resources of each district. Then it could develop a program tailored to meet those needs. Physician backup, standing orders, physical examinations, vaccines, or acute care.
I remember one district in particular that came to us. It was the Wellston School District, and they had a number of kids who didn't have the required vaccines or physical exams, and they had done everything they felt they could to encourage the parents to get those for the kids, and they were about to put the kids out of school. And I mean, this is a socioeconomically depressed district where parents have jobs where if they take off a day to take their kid to the doctor, not only will they not get paid, they may not have a job when they come in the next day. So we met with the administration at the school district and sat down and looked at the issue. Their social worker went door to door to get consents, and then we went into the school and performed the services, and no child had to miss a day of class.
So the partnership with the school districts grew, and then community agencies serving the disadvantaged wanted to partner with the Institute. These agencies served many who could not access health care through the traditional systems. Some simply had difficulty with transportation. Some had no insurance. As you would expect, cost was a major challenge for many. In some cases, those needing health care couldn't use the traditional systems because English was not their primary language. Clearly, a pattern was emerging. There was a need, a tremendous need. But who was willing to step forward and help? The answer? The Institute for Family Medicine. Schools and social service agencies realized that the best way to make sure that students and the disadvantaged could get medical help was to form a partnership with the Institute. Programs were created to provide quality, cost-efficient medical care. The care took place in a trusted location familiar to the patients. Now, usually this was within the walls of the school or social service agency.
Yeah, because IFM serves especially kids that are high risk in settings like emergency shelters for runaway youth, in treatment homes for kids in foster care, and in schools with a lot of high risk, low income kids, they can remove these barriers, and in that sense, they're really in a role where they're the safety net for organizations that are the safety net. They're the safety net for the safety net.
As you can see, the Institute for Family Medicine has developed a unique and much needed niche for service in the St. Louis area. The Institute gets no government funding. It's not about large bricks and mortar. It's about partnerships and collaborations. It's about providing services where the disadvantaged and the vulnerable live, work, and gather. It is about providing quality primary health care and continuous service. Another critical component, building trust. The Institute has a dedicated group of staff and healthcare providers choosing to make this mission part of their careers. Volunteers assist at some of those sites in doing their part to help keep overall costs down. So for more than 15 years, the Institute for Family Medicine has been there with preventative health measures, care for acute illnesses, and even chronic illnesses. In those years, the Institute has taken care of patients in a cost-effective, convenient, trusted setting. All of this reduces the need for costly emergency room visits and hospitalizations, and certainly that would have occurred if the primary health care services were not available. So the Institute continues the mission, but the need is so very great. You can help fill in a necessary piece of the puzzle with a donation to the Institute for Family Medicine. What you give helps the Institute fill the gaps in health care for those struggling. Maybe you are blessed and you don't really worry about things like, how do I even get to the doctor? How do I pay for it? There might come a day when everyone can get quality and cost-efficient health care, but until then, many would suffer except for the work of the Institute for Family Medicine. The Institute wants to thank everyone who has supported the mission through the years, both with money and time. Those contributions have been critical. Will you help meet the future challenges?